Hi, everybody. It's Honest John. In 2008, Ronald A. Williams made $24,300,112. Now, why should that be any concern of yours? Because he's the head of Aetna Insurance. Now, it's hard to imagine what he does that makes him worth $24 million, but that's what he makes. John Hamringer is the CEO of McKesson Corporation, a healthcare company. His compensation with bonuses and stock options comes to about 20 million. So stop a minute and think about how much these companies have to make in order to make a profit. I mean, it's not like these are the only people working in the company. There are regular workers who make regular pay, but there's also a bunch of executives who also make multi-million-dollar pay packages. And there are a lot of healthcare and insurance companies. And not only do they need to pay these bloated salaries, but they also have to come up with enough profit to pay stockholders. Now, when you get your hospital bill or your insurance bill, those items sure aren't itemized on it, are they? There's no line that says executive pay and tells you what percentage of what you pay for insurance or health care is going for that. And yet nobody talks about how these kind of compensation packages are affecting healthcare costs. Here's a little hint for you. The price of bandages or sutures or scalpels is not much different from what it was a few years ago. Nurses' pay is not going up that quickly. They're not even raising doctors' pay that much. But the pay for these top guys is always rising. So you have all of these people that you're paying multiplied by all of these healthcare companies and insurance companies, and think for a second how much money has to go into our healthcare system before any of it actually goes towards treating patients. That's why we're the country that is having a crisis of rising healthcare costs. Because in most of the civilized countries in the world, they don't have this for-profit healthcare system. They have single payer. And what happens is that these CEOs and executives are replaced by civil servants who make a much more reasonable salary. If we did that here in the United States, healthcare costs would plummet. Not only that, but decisions about your treatment would be made by healthcare professionals and not bean counters. Decisions about your treatment would not be based on profit and loss. And believe me, when you get sick, as far as these insurance companies and healthcare companies are concerned, you become an obstacle to their making a profit. And when they look at your medical record, they're not looking at how to help you. They're looking for excuses to let you die. Thanks for listening.